Now I want to introduce Mr. Preston Thompson, who's the Chief Executive Officer of Behavioral Technology, which is a training company dedicated to training mental health professionals in a variety of interventions, but predominantly in dialectical behavior therapy, which is predominantly for people who are suicidal and engaged in suicide attempts and other means of self-harm.
Thank you, Alan, and thank you, everybody here. This is has already exceeded all my expectations for this meeting. Hearing the passion in the room is very encouraging, and there's a lot of days when we need encouragement, and it's really nice to get it today. I'm not a scientist and not a mental health professional. I kind of grew up in the aerospace industry. I worked 33 years at Boeing. But one thing I learned in that career was about large-scale systems integration. And as we talk here, I have several pages of information about DBT, but I want to kind of instead build upon what's been already said. I have heard the word system failure, and that really resonated with me. I remember as a kid, I grew up in New Orleans. My father worked on the space program, and I remember John Kennedy giving a speech about putting a man on the moon. And it was obviously less than a decade from the time he gave the speech to the time we actually had a man on the moon. Now, I happen to be up in Arkansas in a very small town in the Ozarks, and when that happened, and my great-grandpa, who was in his 90s at the time, he said, "They're just funning us." He did not believe that actually happened. And you can imagine why. I mean, he had just gotten indoor plumbing and electricity within the last couple years. And so this was like beyond his imagination. I do not want us to have a failure of imagination and to not turn over every rock in making mental health a priority and finding things that work to alleviate the suffering. Dialectical behavior therapy, or DBT, was originally developed by Dr. Marshall Linehan to treat individuals at high risk for suicide, particularly those with recent and repeated suicide attempts and non-suicidal self-injury. It happens to be the most studied treatment available for suicide behaviors, and extensive research indicates that DBT is effective in reducing suicide attempts, suicide ideation, and non-suicidal self-injury. And I have a lot of facts and data that back this up, and lots of research studies that have been done. But the fact is that there's a treatment that actually works, and it's been demonstrated to work. It was originally developed for adults, but it's since been adapted and found to be effective with adolescents, ages 12 to 18, college students, and children. And its emerging evidence indicates that it's also effective for adolescents with eating disorders, oppositional defiant disorders, and problem behaviors in juvenile justice settings. There's also a lot of data, and I know this is important to Congress, about the cost effectiveness of it. The American Psychiatric Association estimated that DBT decreased costs by 56% when comparing the treatment year with the year prior to treatment. Reductions were evident by decreased face-to-face emergency services, 80% reduction, hospital days, 77%, in partial hospitalization, 76%, in crisis beds, 56%, blah, 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 blah. That's numbers. It doesn't really get at the lives that are impacted that you've heard about today. So, Blaze said something that really is the thing that I wanted to actually close on today, was about prevention and early intervention. I just said that I grew up in the aerospace industry, and I really do mean I grew up there, because my dad was in business, and then I went into the business, so it's where I was raised. One thing that was absolutely imperative, and everybody knows this, it's really a lot better to keep the airplane from crashing than to deal with the damage of the crash. And so we do all kinds of things from a system perspective to prevent that, from the design to the manufacturing to the testing, the feedback loops, the monitoring, the indicators, the early indicators that there might be a problem, that all that stuff that works in industry also works and can apply to the mental health field and to people that are highly suicidal, want to hurt themselves. And prevention is not only more effective, but from a humanitarian, a social, and personal level, it's the right thing to do. And I really appreciated the Congressman talking about, like, if we can find the cost to do this, that, and the other thing, why can't we find the money for this? And Perry's going to talk to you about family connections, and this part of the system, too, that gets overlooked, is how important families are. You heard two parents here today. They have to be part of the solution, and they have to be given the tools and support systems to teach, encourage, build up, and help their children. Same way in the schools. The teachers, they don't have any training in this. They see the kids all day long, every day of the week. What are we doing? They should be early indicators for us and being able to have the opportunity to do early interventions. I really appreciate everyone coming today. This is not about DBT. This isn't about a specific program. This is about how do we get everybody working together to solve this crisis. Thank you.